Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, criticism of public health during the pandemic coming from a prominent leader in the field. Dr. Sandro Galea is the dean of the Boston University School of Public Health and author of a new book entitled Within Reason, A Liberal Public Health for an Illiberal Time. In today's episode, he speaks with, and at times debates Dr. Josh Sharfstein about his view of where public health went wrong. Let's listen.
Dr. Sandro Galea, thank you so much for joining me here on Public Health on Call to talk about your new book, which is called Within Reason, A Liberal Public Health for an Illiberal Time. And I want to ask first why you wanted to write a book about politics and public health.
First of all, thank you for having me, Josh. It's great to be here. I think I wanted to write a book because I care deeply about public health. And I have written other books about public health, and I have tried to always think about where should we be nudging public health. And I think I did that with my very first book about public health broadly was called Healthier. That was about 8 years ago now. And at the time, I felt it was important for public health to be open to embracing the full range of issues, like structural racism and gender inequity that I thought were important parts of public health. And my thinking has evolved and built on those topics. And I think at this moment in time, I felt it was important to write a book about the perhaps underlying philosophical orientation of public health. I'm not sure I wrote a book about politics in public health. I think I wrote a book about underlying philosophical orientation because I wanted to make sure that I did my part, my very small part, towards inflecting our conversation in a particular philosophical direction, which in the book I call liberals.
I think it would help for you to define liberalism as you intend for it in the book.
Yeah, by liberalism, I mean the sort of fairly classic sense of liberalism inherited from the European Enlightenment. If anybody who has the book is on page 6. I talk about how by liberalism, I mean organizing our thinking around reason, around free speech, plurality of perspectives, around the pursuit of truth and the preservation of liberty, by which I mean centering individual autonomy. In public health, we often use the term human rights, which fundamentally is derived from this notion of autonomy. So it really is a world and a conception of the world where we engage one another with a difference of perspectives, where we listen to a difference of perspectives, cast aside ideology and belief, and try to build a common understanding, a consensus, wading our way through potentially competing perspectives to a place where we move society forward. And I think that broadly captures in my mind liberalism over the past several hundred years. And the important distinction, which I think is important to make here, is that liberalism is not, I don't mean it in the classic sense of the left. I think there are elements of liberal thinking, both on the left and on the right. And I realize when I call the book A Liberal Public Health, I might be perhaps losing some readers who have the assumption, but I know no other way of capturing thinking this way, which is why I still use the term.
Partly, as you're describing in the book, the goal of a liberal public health, you are criticizing what you see as illiberalism in the field of public health as something to avoid.
Yeah, and I think the way to explain that is really I have to go back to what the book's about and the phrases that I use in the book. And, in the book, I say very clearly that COVID-19 was public health's finest hour. And I'm very clear about that. And just so that we are all on the same page, public health saved millions of lives during COVID through the rapid advent of vaccines, like in extraordinary record time, through finding ways for testing, rapid screening, contact tracing, isolation, all the classic public health measures. COVID-19 was a terrible tragedy in the US. It would have been much worse were it not for the good work of public health. I'm also clear that public health did its work in a time of extreme duress. And obviously in context of a pandemic, which would have been extreme duress under the best of circumstances. But the particular duress that I refer to is the influence of the person who was the president at the time, who was Donald Trump. And I call this out very explicitly in the book, where I make the point that Trump was, alternately denying of COVID, maybe accepting COVID, denying of the efficacy of vaccines, accepting vaccines. So in many ways, acting in a paradigmatic, illiberal way. And in reaction to that, public health adopted some of those same approaches, and in perhaps consciously or unconsciously, that moved public health away from the ideas of pluralism, focusing on data, reason, logic, hearing multiple voices to guide society in a way forward.
And that's a pretty serious criticism coming from someone of your stature within the field. Could you give some examples of what you saw was a liberalism in public health?
Yeah, I mean, I do use some examples in the book, and I'm careful not to use too many examples specifically because I actually want the book to be forward-looking rather than backward-looking. But one example which I use in the book is how public health, for example, dealt with the emergence in the summer of 2020 of the Great Barrington Declaration. And I'm very clear in the book. I actually don't agree with much of the Great Barrington Declaration, but in my comment is not about, I want to be very careful about this and clear about this, is actually not about adjudicating the Great Barrington Declaration. But, if I may, I'll read a few sentences from the Great Barrington Declaration, which says as follows. Adopting measures to protect the vulnerable should be the central aim of public health responses to COVID-19. By way of examples, nursing homes should use staff with acquired immunity and perform frequent testing of staff and all visitors. Staff rotation should be minimized. Retired people living at home should have groceries and other essentials delivered to their home, etc. Things like that, I think we broadly would all agree with. The challenge is the way that was met, and now I will read some other quotes, is from a group of distinguished scientists. The quote was, herding people to slaughter, the dangerous fringe theory behind the Great Barrington Declaration. So the point I'm trying to make, and I realize it's a difficult point, is not one of agreement or disagreement with the Great Barrington Declaration, which, as I say explicitly in the book, I actually disagree with the bulk of it, is that something which actually had elements in it that I think we gladly would all agree with, like the phrase I just read, was met with a closing of mind and a rejection that bordered on using rhetorical tools that were non-rebuttable to push it out of our consciousness. And that, to me, is classically illiberal. When one talks about speech and one talks about space for plurality of perspectives, one of the tenets of speech is that speech needs to be rebuttable. And when you're saying that something is herding people to slaughter, it's hard to rebut that. So I think that's an example of what liberalism.
Could you be more specific within public health where you're finding the illiberalism? You and I have talked about this a little bit. Public health is a pretty broad concept. It includes the academic public health. It includes people in public health practice. It includes the director of CDC. It includes, people who are on the front lines of the COVID response. When you spot this illiberalism, do you see it across the whole field? Because to some extent, your book has been interpreted as a criticism of the whole field. And I could quote from some very reasoned responses to the Great Barrington Declaration that didn't have that kind of language, that actually pointed out some fundamental errors in the thinking behind it that turned out to be very fair criticisms, I think, with the benefit of time. How do you talk about where you see the illiberalism without kind of tarnishing the whole field?
Yeah, it's an excellent question, and I it would be a source of personal sorrow if I tarnished the whole field in doing this. And I have been very careful about what I said and what I've written, and I'm aware. It's a bit of a catch-22, Josh, right? That one can write a book and name names and point to specific examples, or one can write a book where the one doesn't do that. The danger of the former is it impugns people who might have been under duress and tried to do the right thing, even though what they did was perhaps illiberal. The danger of the latter is that it becomes to seem like the whole field. So actually, I appreciate the tension, and I'm not entirely sure, what's the right way of doing it. But in the book, I think I'm clear many, many times about the fact that the many in public health did extraordinary work to save a lot of lives. And I'm trying to extract lessons from things that I perceived, and I think many others in the field perceived. Now, the question about who was doing these things. And, when you and I have talked about this before, I think one point you made, which I think is a reasonable point, is like, well, it's not really everyone in public health. There's no intention to say it's everyone in public health. It might be perhaps a group of partisans in public health. I actually make reference to that in the book, and I make reference to the fact that, of course, it is the challenge is that when our perception of us is mediated through a vocal group, and whether that group represents all of public health or whether the group is just part of public health, it doesn't change the net impact as to how society perceives public health. And that's in part what I'm trying to get at.
I hear you. Let's maybe talk about one of the other examples of your book, which has to do with the use of COVID-19 vaccines in children. You memorably ask in your book, were we recommending them, and I'm paraphrasing a little bit, for the children or for ourselves, meaning for adults? And you say, well, look at the difference in mortality between COVID in children and COVID in older adults, which is, of course, a huge difference in mortality. And, you could read your book as coming down on the side of, or basically implying that, again, there was illiberalism in public health by recommending vaccines for children. Would that be a fair reading?
No, I think, well, I don't want to say not fair. I mean, fair is a big word, but I would say not exactly accurate reading. Let me edit it that way. And I'm very clear in the book that I have two children, both of whom were vaccinated. So I'm very clear that I actually thought the decision to vaccinate children is the right one. My point about illiberalism is not the recommending the vaccination of children. My point is about the extent to which there was a discussion about it, and the extent to which that discussion was fulsome and reckoned with other examples from other countries. Now, I understand, and it's because you and I have talked about this a little bit before, that you can say to me, but actually, Sandro, in my circles, there were a lot of discussions. And I don't doubt that. The point I'm trying to make is that whether in Professor Sharfstein's circles or even Professor Galea's circles, there were these conversations, I'm not entirely sure that the public and our broader image was one where those discussions happened, which of course is then evidenced by the problems we're having now with trust in public health. So I realize it's a subtle argument, but I think it's an argument, obviously I think it's an argument worth making, which is why I wrote the book.
Right. I mean, there were discussions, not just in my circles, but at the FDA and the CDC, looking at the data, looking at the risk of COVID-19 for kids, the risk of multisystem inflammatory syndrome for kids who got COVID. Do you think that those recommendations by those government, experts, those advisors, were made to support the health of children? Do you think that they genuinely believe those recommendations would support the health of children? Or, as you said in your book, do you think it was because they were aiming to treat themselves? I mean, is this an indictment of the people who put together those recommendations? I just want to be clear about that.
Not at all. I actually think that, look, I have a deep love for public health and the people in it. And I think the people in public health acted based on what they thought was right. And so there is no indictment of people's intentions. There is simply a question about the extent to which our intentions were motivated by our collective sense, in some respects, of siege at the moment, driven obviously by the pandemic itself, but also by the dramatically illiberal actions of the president and sort of the whole executive branch, and whether that pushed us to act similarly. So I have no question that the people in the relevant positions were acting in good faith. And I'm very clear about this, about the fact that I actually thought the president was acting in bad faith. The question is whether or not our cognitive mindset was informed by the spirit of inquiry and open-mindedness to plurality of ideas and learning from others who have taken different approaches that we should have taken.
I'm trying to, I absolutely hear you that your intent was not to impugn people who are involved in the decision-making, but at some level, you're criticizing the decision-making.
Well, I suppose, as with everything else, one has to break down the sentence. Is it the decision-making? Is it the process of decision-making? Is it the inputs of decision-making or decision itself? So let's take a step back. I'm clear, as I said, I was clear in the book. I'm not criticizing the decision. The decision is the decision.
Right.
I'm criticizing the process. I mean, I suppose things like, when we have phrases out in the world that, call alternate perspectives, and I quote some of these in the book. Ill-advised and arrogant. These things were emerged from public health. People of some standing in public health quote, an ethical nightmare, quote, giving oxygen to fringe groups. My point is, it's hard to allow space for different perspectives. Now, when we spoke about this before, you made the point, which I thought about the points you made, and I think you make some good points. So, maybe we were too sensitive, but it's hard. It's hard not to be sensitive when people call alternate ideas ethical nightmares. And in some respects, that's what I mean by liberalism. That we are not acting in a way to be generous to create disagreement.
Well, I appreciate and agree with you. I will just say that there are moments in maybe what we could call the public health discourse, the discussions that were happening, that were illiberal by your definition, that were inappropriate by my definition, where people were unnecessarily nasty and closed-minded to some extent. I think you and I agree on that. And I think that the book does go through some examples of that. I think maybe where we disagree is how much of the public health community are we talking about here? And whether we're really talking about the agencies, the public health officials in the field who are leading the COVID response, whether it's fair to kind of tar them with the same brush as like somebody who's really angry on Twitter, and in many cases, the people who were the angriest at public health officials, who were, I think, frustrated that their view wasn't really being heard. And many of their attacks were leveled at public health officials rather than it being a attitude within the entire field.
Yeah, I suppose I might be utilitarian about trying to answer that, which is to say, where are we at now? And where is public sentiment at? In the book, I quote Lincoln on public sentiment, something like, without public sentiment, nothing is possible. And while I think the distinction you're making might be correct, I don't think public sentiment sees that distinction. I think it's a very fine distinction that you're making. And I suppose what I try to do in the book is I try to reflect back on us, where public sentiment is about us and why I think public sentiment came to the way it is. When I talk about things like moralism, I talk about things like the our cruelty and sort of liberalism of thought in particular areas. And whether that distinction, whether that public sentiment reflects a smaller group of potentially, let's say, partisans, which is a term that you had used, or what you and I might call the establishment. Let's just for a second have the hubris to say we're part of the establishment, you and I. I suppose I'm not sure that it matters, because I think the public sentiment is sweeping us all. And what I try to do is to say it is better for us to reflect on this coming from us, and to do so in a way that is capacious in its generosity of spirit towards public health, rather than let such critique fall to others. In the book, I quote Orwell when he was talking about what he perceived as a liberalism or progressive movement in his times. And I don't know if you remember that section, but he talks about the challenges that he had, where in time of his writing, the challenge was around slums, and where it did not suit the progressive argument at the time to admit there are slums. I said, what are you supposed to do? Not admit there are slums? Because they are there. I can see them with my eyes. And the other argument he makes is it's worse not to admit to these things. And it's important to do so to give us a moment to pause and reflect. And I try to do so from a place of someone who wants the field to thrive rather than from place of many who I think are acting in bad faith and do not.
I do appreciate that was what you're aiming for. I think by not drawing distinctions between people who were very closed-minded tweeters and people who were doing their best through the public process to find answers to some of these difficult questions, I think it creates the impression that this is a broad critique of the entire field. And, in particular, you raise the question of, well, why are so many people frustrated with public health? Why does public health have a worse reputation in some respects after the pandemic? Is it because of this group or this minority, in my view, of people who were acting illiberally, or is it something else? I was really struck by your casual attitude towards Joe Rogan and misinformation in the book. And, you describe people in public health as pearl clutchers, which I'm not exactly sure what that means, but I think it means like overly sensitive to the idea that a podcast with tens of millions of listeners could be attacking public health in some cases as, authoritarian. And from my perspective, it's far more a problem that was happening than that there were some very divisive and even inappropriate exchanges on social media.
Well, the beauty of a liberal approach is that we can have this conversation. So let's go to Joe Rogan, and then I want to get back to partisans, if I may.
Sure.
But let's be specific about what I said about Joe Rogan, because I realize that this bothers you, so I want to respect it. Page 133. There are two things I say about Joe Rogan. I'll be very specific, and I'll quote from the book. It's easy for the Rogan phenomenon to seem inexplicable when seen solely through what is written about him and through some of his more ill-advised statements. However, given his influence on the health conversation, it's worth listening to some of his episodes in order to better understand why he resonates with so many. So number one that I said about him is we should try to understand why he resonates. The second thing that I said about him, very specifically, is that Rogan often pauses conversations to ask guests to explain concepts. He issues corrections and responds to new information in real time. It could well be that he's trusted by millions because he cloaks ignorance in authoritative tones. ... Might we perhaps learn from this? So the two things that I said about Rogan are, number one, and this is on page 133, you can see it. Number one is that given so many people listen to him, that perhaps we should actually try to understand why he's so popular. And number two, given that actually he conveys his what he knows, what he says, through a place of humility, maybe we can learn from that. And I think it's reasonable to actually learn from Joe Rogan in that way. So I understand that the very mention of him is in some respects a bit of a trigger, if I may. But I actually think the way I mention him is entirely reasonable. And actually, I think it's defensible to say that we should learn from someone who is the most popular podcaster in America by quite a long shot. And actually, we should understand why he's so popular. So that's my point about Rogan. I mean, you may feel otherwise because I understand that he's offensive in many ways. But to my mind, it is paradigmatically closing our mind to what we can learn from the world, not to someone like him.
I have no concerns about learning from popular podcasts about how people get information, for example, or what techniques or styles they like, which is, I think, your point in part here. But I think it's hard not also to connect some of what happened in particular with him and with others like him to the underlying phenomenon you're talking about in the book, which is the distrust of public health. So I think it is, I think for me, it was kind of the casual language about the frustration that people had with Joe Rogan more than the statements that you read about the potentially what we could learn about his style.
We may have a point of disagreement about a colorful adjective, and perhaps that's the case. I will concede that I will lose some sleep over that adjective for days to come. But leaving that as it may, there's a deeper point in the comment you just made, separate apart from the adjective, which, as I said, is the point is well taken. That why write a book looking at public health when there were so many others who were bad faith actors. And I think it's a valid point. I mean, there is a book to be written about all the forces that are bad faith actors. But in if I may, in terms of for a book about that is explicitly from within public health about public health, if one were to just go to the index, anybody holds the book on page 275, and you look up Trump, you will find in the index, I'm going to read from the index under Trump, bad faith, bigotry of, censorship of, division and conflict promoted by, health harms created by, liberalism of. So it's not. I don't think it's accurate to say that in the book I actually, and I could go on. I mean, you can see it right here. So it's not accurate. I don't acknowledge these things, but I'm also explicit to say it's not on me to write a book about about what others have done to us. I acknowledge them, but I want us to reflect on ourselves. I mean, to be honest, I feel a little bit like Josh. It's like after an election, without naming names, a prominent politician loses an election and then writes a book that says, let me tell you what others did to me. To which I'm like, okay, that's true. But how about we reflect on ourselves? I want to come back to the partisan point, if I may, for a second, because I do write about this. I'm explicit about this. I say here, as elements of our pandemic response were co-opted by partisans with all sorts of motivations. This is, I would stress, categorically different from robust, good faith debates aimed at achieving best practices to help us navigate this difficult moment. So I do try to separate the partisans from the good faith debates. Now, I understand how a good faith actor might look at the book and say, well, that wasn't me. Now, if I may use the language that you had used, say, well, some people who were criticized were being too sensitive. I might say, we might be too sensitive if we see the book that way, because it's the book is intended was to have this conversation, and this conversation is actually the paradigmatic conversation I was hoping to trigger this book. Listeners can agree or disagree. That's okay, as long as we just reflect on it just for a minute.
Well, I appreciate the chance to have this conversation. I want to end on a point of, I hope, agreement here, which relates to your earlier point about process. It has been my view, and I have not been someone who says everything went perfectly well during COVID for public health. I've written and been quoted on many different topics otherwise, but one that I have paid a particular amount of attention to has to do with the process of decision making that public health officials went through. Oftentimes, there was little process. Oftentimes at the beginning, there was no time for process. And then later, politicians made decisions really without a lot of public health input. But even when there was time and more opportunity for public comment and engagement could have been taken, often it wasn't. And so you wound up, I think, even where people were proceeding with the best intentions and maybe in many cases making good decisions, people perceiving that the decisions were being made without meaningful input or consideration of their concerns. And I don't think that was a good long-term strategy for public health. And I think it probably did generate some frustration. And I think it's something that the field needs to learn from. Maybe in the parlance of your book, there could be more liberal processes that are brought into public health decision-making. Even if maybe we disagree on whether or not it was, fully illiberal, but that there are ways to signal and act with the intention of listening to others that public health could learn from.
Yeah, I agree with that completely. I think this is actually now where I come into defense of public health, where we're changing roles, because I actually don't think, and I try to make this clear in the book, that those who are in charge of making particular decisions meant not to do it this way. I actually understand that. I actually think, which is why I sort of in the book, I link it very specifically to the moment, to the political moment, to the influence of Trump and the outside forces. So yes, I think that would benefit us all. And I think the other element of this, which just didn't come up in this conversation, but I think it's important to put in our space, is, and this is something which I sort of make as one of the 5 key points in the book, is that we have to remember that we lived this for the first time as a disaster through the era of social media. And social media is a very particular form of communication, which we just had not lived a national disaster through with this particular mode of communication, which rewards certain forms of communication and certain forms of process and lack of process. And part of what I think we need to do, and we're trying to encourage us to do, is to reckon with how to do better in terms of being liberal, listening, pluralism, divergent ideas in an era when our communication is constrained by this medium, also facilitated by, but also constrained by this medium. So I think these are all ideas that we need to iterate on as a field to find the best space forward.
Well, Dr. Galea, I really appreciate this conversation. I look forward to many more. Thank you so much for joining me on Public Health on Call.
Thank you, Dr. Sharfstein, for modeling liberal conversation.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Ciceri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Ciceri and Eliza Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.